we need to start from the basics. And Chance, this is I've also seen another song, People by Libianca. I'll be playing that as we go on. Njagala kusooka kubuuza if it's very okay. Mental health kitegeeza ki? Mental health, omuntu bwagamba nti my mental health needs support, aba ategeeza ki Kyanzi, if I could ask in that angle?
Omuntu, according to what I know, is generally speaking from experience, from the experience side of point of view and stuff. Omuntu agamba nti my mental health yetaga support. I believe kiba kitegeeza nti they know they're struggling, and the time they come up to say it, baba baze ku the end.
So already I picked the word struggling, right?
Emotionally.
Okay.
They're struggling with mentally, their their psychological thoughts are struggling.
Okay.
So, bachogera they're struggling to the point that most of them are about to say to the bridge, to the end of, things now are suffocating, So they will vocalize it. Vocalizing in different ways, through actions that are really easy to tease us sometimes. That's what I understand by that. Mental health is not really good. They're struggling emotionally and psychologically.
Already, Dorothy is saying, I think people rarely say their mental health needs support. Yes.
Oh, yeah.
That's very true.
Yeah.
These are some of the pains people struggle with every single day. Like people go through a lot of emotional breakdowns, a lot of psychological breakdowns, like Chanza said, but very few have the courage to actually come out and speak about it. This is why mental health issues are a very serious disruption of how people become productive, disruption of how people become, active in terms of development and growth. Because a number of people would rather hide what's going on with them than coming out to speak. And yet coming out to speak is one of the first levels of dealing with the hidden pain, So let's now, Chanzi, do you still want, because I feel like what you've mentioned is actually categorically, this is what we all struggle with. Do you still want to expound more? Because I really want people to understand when the word mental health is mentioned, I want people to understand how should people view it? How should people be talking about it?
So right now, people are talking about it. We have people who have awareness, people who have different views about it, because people are now more leaned into really embracing it right now, which wasn't the same situation before, But how should people embrace it is through, the doing, putting our words into action right now. Because to me, I feel like it has been long overdue. We've had the days whereby people couldn't talk about it, and those who are suffering could hardly talk about it, apart from those who are very extreme, very extreme abamu. Those who are like suicidal, they're really struggling. Are they on a very minimal level? Now, the more people are talking about it, we are seeing more people really, some people even diagnose themselves, Naga Martino, I'm bipolar. That's to the extreme. I really feel stressed. I really feel, depressed. People are now attaching certain words to it. I'm anxious. I'm
Yeah.
having a panic attack. Just a few of us really talk about these issues that we now recognize. Now, yeah, how we should embrace it right now, because now we have schools talking about it. We have professionals really coming up to, talking to us. We do have workplaces now incorporating that. We do have countries whereby, governments have, things in places. But the thing that is going on, that we are so ingrained so deep in our traumas, that we are stigmatized, we are stagnant, we are procrastinating, and hardly can move sometimes into action. So how should we view it right now? And something I'll ever promise myself, if I ever go public to talk about mental health, we have to talk about it in a very um, perspective way. So this is how I want people to view it. Yes, we still have a long way to really, most of us, to get to understand it, to embrace it, to have safe spaces. But those who have, reached those spaces, we need to start doing the work, not just talking about it, but addressing it and making it part of us, of our daily activities.
I really think there is a huge job. I just wanna say this now, that to me, I think mental health is how I feel. Mental health is how I think, and mental health is how I view situations that I'm going through.
Right.
And I'll give you a case in point that several, many times, my mental state changes, especially every time I have a challenge going on in my life. Yeah. I have very, I have a very big challenge with stability every time I have a challenge. For example, if I have a sick person in my life, and probably I've been to hospital and they've told me this person might not survive, or this person is really, their chances of survival are very minimal,
Right.
that hits me differently. It makes me think about life like some bit of useless kind of piece of stuff. And every time I every time I get to think about life, it then brings me this thought of, how about people that are actually living with certain struggles on a daily and still want to push through? So I keep thinking about one of the ways I actually overcome such struggles of thoughts is I think about people going through deeper pain than I am. And I ask myself, how do they survive? How do they wake up every day and keep pushing through? I mean, somebody's diagnosed with an incurable disease. Somebody is sacked from their job and they walk back home, there is no more job. Somebody has been in a relationship for a very long time, and one morning they say, we are parting ways. So I keep thinking about all these pains and I'm like, okay, probably my pain is not the worst, or like I don't have the deepest pain of that. But this also hinders my productivity. Every time I have my productivity, it hinders the way I think about situations. It hinders the way my output comes out. I don't know if other people actually go through the same thing, that sometimes the way you feel can actually entirely block off how productive you are for a very long time, until when those feelings, until the way you think about things you're going through has been somehow supported to come back to a certain level. This is how I view mental health. Like every day, let me tell you something. If there is anything that when we grow up, and even as children, if there is anything that needs to be taken care of, I think it's the way our brain functions. It's the way our
Yeah.
brain works. Because I don't need no doctor to tell me about mental health. I'll be honest with you, Chansey and Dorothy. I don't need no doctor to tell me, because even when I wake up and I've just had a quarrel with my wife, that alone is enough to break me, or sometimes give me very, very restless, hours and time. And that has a huge impact on the way I think and the way I become productive. So it's a conversation that we all sit on. I'm telling you, like sometimes people smile and people find a way to fit in society, but with very, very heavy hearts, with very, very heavy thoughts. And for me, this is how I view this entire concept and this entire subject of mental health, that I don't actually need a doctor to tell me, because it's an everyday experience. How I learn to cope with my struggles is what actually makes me maybe mentally more fit than people who cannot learn how to cope with their struggles. Because I think that is the leverage that we have, that me and you, Chance, can be going through a financial crisis. The way you decide to handle the financial crisis is actually what makes a difference between you and me. And if, for example, I spend more time wailing more about my challenges, then it's gonna put me down for a very long time. But if I
Right.
got a way to cope with my struggle, then it's gonna be much more effective in how I try to overcome this. So this is my own way how I understand mental health. Maybe probably I would love to listen in from Dorothy. Dorothy, when we talk about mental health, what comes to your mind? Like, what does it mean to you?
I think it's to me how I view mental health, like exactly how you've explained it. But this is a to me this is a topic that I'm very passionate about, and because I actually came to know about mental health is when my mental health deteriorated when I had my first child. I was clinically depressed, but through a going to counseling, it was later on I remember psychiatrists saying that actually it wasn't depression, it wasn't postnatal depression per se, but prior to me having my child, I moved to the UK 6 months after my father had passed away. And prior my dad's passing away, there had been like five deaths in a space of 2 years, uncles, aunties. So which so if you add that on and then moving to a new country and 2 years down the line you have a baby with no support at all, like as I've come to know, it is definitely going to impact a young adult's mental health. And but the longer, but I think the more and the fact that I've always been open about my mental health, especially, and yeah, my mental health. And I'm quite glad that even my child chose a career into mental health. And the more I've looked into this, yeah, I think I would say I don't know, but I think within the community of Ugandans, I had always been open about me being depressed, and actually knowing that I do get depressed, that I do suffer from both depression and anxiety, or what they call generalized anxiety. But over the years, I've learned to basically, I think over the years, I've learned to manage myself. And one of the things that probably one of the things that is not talked about within our culture is like, or sadness, or we are not meant to feel sad, or when somebody loses a job they expect you to literally, oh, don't worry, you'll find another job, or somebody leaves you, or don't worry, you'll find somebody else. That we do not actually grieve It is grieving, is necessary. Whether somebody has lost a job, it's not a time to tell them, oh, you go find another job. It is accepting that probably this is a career they planned for since they were 18. They've been there for 6 or 10 years. They've built friendships. They're walking away. Probably they've started projects and they've seen them to fruition. And right now they're not going to be part of that team. They commute everything. So they are grieving so many things. And if it takes them 6 months, it is absolutely fine. There is nothing wrong with them, because grieving is a natural process. And I think one of the things I've realized that it starts from childhood. Like maybe like you, man, you've got a child. For me, when my children, the young ones, if they break a toy, it's not like, oh, don't worry, we'll buy a new one. I'll say, let's see if we can fix it. And if we can't fix it, we are like, you know what, we couldn't fix it, and we would talk about it and allow them that, you know what, sometimes we have things and they break and they cannot be fixed, and it's okay. But when we live in a society whereby even as a child, if they break a toy, you go and you replace it. So that means you've taught them that everything is fixed. So if they grow up, they've never known of things not being fixed. If you as a parent, like, you could afford XYZ, there is nothing wrong with telling even a 6 or 7 year old that, oh, by the way, daddy has been going to work every day and he's been able to buy XYZ. That is not going to be working anymore, so that means maybe we've been going to buy ice cream. We won't be able to buy ice cream anymore up until probably, because that is going to have very little money coming in, and that money is going to be spent on most. So from a very young child, you're teaching a child that losses are part of life, adjustments are part of life. We plan things and different things happen, but what happens, what I've realized, that why as adults we struggle with mental health, because even as young children, things were hidden from us.
Right.
So now, as we are growing up and we are facing these challenges, we look at ourselves as failures. That's when you hear people, I never had my parents argue. We never gone without. The fact you never gone without, because your mother could go and borrow, could go and do XYZ, or your father, so that they can make you live the life that you've been used to. But what is wrong with being honest with your children that, what? Things are going to change. Things have changed. Daddy is not working anymore. It is only mommy that is working.
Thank you, Dorothy. This is actually getting more interesting, because I now imagine that, I had a bigger picture of what I think mental health is for everyone, but from what you've said, it categorically gives me a picture that what I thought is actually not right. Everybody has their own struggles, and those struggles impact their mental health differently. For example, you've talked about pregnancy, you've talked about a baby, you've talked about this period where you transition from one country to another, you probably from one location to another. This brings me to a very deep conversation that I want to have with you. Both of you Ugandan, but not staying in Uganda.